Not everyone who self-harms wants to die, but almost everyone who is self-harming is going through something. I am Dr. Alleyne. I'm a psychiatrist. When some people hear self-harm, which is the action of hurting yourself on purpose, people tend to assume that that person wants to end their life. And that may not be true. For many persons who self-harm, they're doing it to try to numb or distract themselves from the emotional pain. So they will say things like they just feel like the physical pain was easier than feeling the emotional and mental things that they were going through. Sometimes people would experience feeling too numb, too angry, too overwhelmed, too anxious, too hurt. And in that moment, they felt like the only thing to release what they were experiencing was to hurt themselves. It really was a way to try to at least temporarily escape the emotions. Now, that doesn't mean that self-harm is safe, because the more times a person self-harm, the more likely the risk of suicidal thoughts and suicide in the future, which is why it always deserves attention. So if someone tells you they self-harm, or you notice that persons have marks on their body that says that they self-harm, don't respond with anger. Don't dismiss it as just looking for attention. And don't just assume that they're trying to be dramatic. Instead, get curious about it. Ask some questions. Listen to what they have to say, and then help them to get professional support. Because self-harm is often a sign that someone is carrying more than they know how to manage on their own.